Today, I will be speaking to you about our project evaluating London school superzones. What are school superzones? School superzones are an initiative piloted in London between 2018 and 2019. The aim of school superzones was to improve health and healthy behaviours in children and young people using health shaping powers available locally. The slide outlines a list of agreed priority actions to address a range of public health issues. By 2020, it had been introduced by 13 London councils in selected areas. This slide outlines the original evaluation plan. We set out to provide a retrospective evaluation of school superzone areas in 13 London boroughs that had implemented that approach. In addition, we also intended to provide a prospective evaluation of new superzone areas in other local authorities. However, due to COVID, our school-based evaluation and council-based evaluation had to be placed on hold or postponed. However, in an attempt to continue with our evaluation, we have had to adapt our research over the last year, and in doing so have set new aims and objectives for the project. The new aims and objectives are as follows. 1. How has COVID affected local communities' experiences of their neighbourhood environment in superzone areas? 2. What factors previously and currently influence the development and implementation of place-based public health initiatives in London superzone boroughs, using superzones as a case study, but also comparing other place-based public health? Thirdly, what are the challenges to ensure similar place-based initiatives post-COVID will improve public health and reduce inequalities? In an attempt to evaluate how communities have been affected by COVID, we conducted outdoor socially distanced discussion/art sessions in parks. We felt it was important to engage with a wide range of residents in two superzone areas, whom we wouldn't have been able to engage with due to digital inequalities in more deprived areas. And on this slide, you'll also see links to our outputs from the project in the form of 2 online exhibitions. And here is a snapshot of our Let's Hear It exhibition we conducted in Walworth. And here is another snapshot of our Let's Hear It exhibition that we conducted in Merton. So from looking at this slide, we can see that from initial analysis of the work commissioned by local arts collective FAT Studio, there are a number of interesting themes emerging. In this presentation, I want to draw your attention to 3 points in particular that have emerged from the study. Firstly, the impact of COVID is felt widely by people in terms of the disruption to everyday life and shows the impact of lockdown on our physical and mental health. Secondly, access to outdoor space and community support has been central to individuals' ability to cope and enabled positive experiences of the pandemic. Finally, COVID has had a major impact on the way individuals view their own bodies and neighbourhoods. The longitudinal consequences are far-reaching and will continue to shape individuals' thoughts and ideals as they adapt to the new normal and post-COVID recovery. Our current research, using online photo voice interviews and focus groups, aims to explore the challenges to ensure superzones and place-based local initiatives post-COVID will improve public health and reduce inequalities. We are currently recruiting from 2 age groups who live in superzone areas, young people aged 16 to 24 years and adults over 25 years, to get insights from the community and those who live, work, shop, play in the local area. Our planned outputs from the project are virtual exhibitions and physical displays in the communities, alongside producing wider analysis that will input into our project. If you wish to know more about our project or wish to get involved, please contact me at sophie.rowland@lshtm.ac.uk. Thank you for listening to this presentation.